Hi, my name is Carolyn and I am a physical therapist. In this series of instructional videos, I will be talking about common issues that older adults face and how you as a provider can help manage them. Topics include transfers, moving from sitting to standing, assisted device usage and fit, guarding the older adult to prevent them from falling, and how to identify fall risk hazards in the home. Here to help me today to demonstrate transfers is my colleague Darcy, also a physical therapist. But first, let's talk about what a transfer is. Transfer simply means moving from one surface to another. So for example, moving from sitting to standing, or from lying in bed to sitting at the edge of the bed. Unfortunately, many older adults have problems with transfers due to normal age-related changes. So this is where providers come in. How can you help them do this better? I've seen many different techniques, both good and bad, as a physical therapist, and today I'm going to talk about the safest way to do so in order to minimize injury for both you and the older adult. But first, a few big picture items. Number one, you always want to protect your back. This is really important. Your back is extremely essential to your job as a provider, so you really want to bend your knees, keep your back straight at all times. Nose over toes. That's a really important principle. You need to get your weight forward enough while you transfer so that you can actually stand up. So you always want to tell the person you're working with, put your nose over your toes. Proper positioning for both you and the patient is extremely important, and I'll talk about that in the next section. And the height of the surface that you're on. If you're on a really low surface, it's harder to stand up than if you were on a really high surface. So just changing that could change the amount of assist you need to give the older adult. So now let's talk about proper transfer components. Oftentimes, older adults may have trouble standing up simply because they don't have the proper body mechanics. So you want to tell your patient, scoot forward in the chair, put your feet under your knees, nose over toes, use your arms to help you, and stand up. Sometimes you might also want to tell them to rock for momentum. You don't always need to do this though. You may find that after telling them those things, they don't need any help. They can do it on their own because they use the proper mechanics. However, if you're still having trouble, this is where we come in and where we can help our patients stand up. However, there's a wide range of assists, so just keep in mind that each transfer is different based on the person. First, I'll talk about mod to max assist transfers, which essentially means that as you as the provider are giving them 50 to 75% of the work. Okay, so we're going to demonstrate for you how to perform a mod to max assist transfer. The most important thing is your positioning. This is going to set you up for success. For her level of assist, you want to be directly in front of her, feet on either side of her feet with her knees in between. That doesn't mean you have to squeeze her knees though. You just want to be there in case anything happens. So let's suppose that she actually had a stroke and her left side is weaker than her right. This is what you want to do is something called blocking. We do this all the time in the physical therapy world. It's to ensure that when she stands up, she doesn't buckle. Because if she buckles, she's going to fall. So you place your feet on either side of her leg with your knees in front and to the side. Not like this, she'll fall right through, and not like this, that's going to hurt. So right here is a good spot, and as you can tell, when she stands up, she's not going anywhere. I've got her in case she buckles. You want to squat, instruct her to place her hands on the table, put your hands around her back. So a couple key things. She's like a 50-pound box. She needs a lot of assist. If you were holding a 50-pound box, you're gonna hold her real close. You're not gonna be out here. This helps minimize injury. You're giving her a hug. Interlock your fingers, and the other important thing is where your hands are positioned. If she's a moderate assist, meaning that you're giving her like 50% of the work, a little higher works. Or if she is actually a max and needs a ton of help, a little lower. So the more assist you need to give, the lower your fingers. All right, so now for the actual transfer, I want you to do as much of the work as you can. Put your hands on the table as you already have. We're going to rock to the count of 3, and I want you to make sure you lean forward, okay? You ready? 1, 2, 3. gave her enough room so that she could actually get forward enough. You want to make sure that you don't just block them from actually getting in that position. All right, so now we're going to sit back down, reach back, slowly lower yourself. Perfect. So let's say your patient only needs a little bit of help. This is what we call a SIS transfer. Essentially means that you're doing approximately 25% of the work. You don't really need to stand in the front of them for this transfer. You can if you want, but most people stand on the side. So what you do, one hand on their lower back, one hand on their shoulder, but it's really important to note, do not pull. This can really injure them. So if you go like this, you shouldn't. You're just here to stabilize them if they need it. You're not really doing much at their shoulder. It's just here if you need it, okay? With this hand, you want to guide their trunk forward if they need help. To instruct them to push up on the table again, and we're going to stand, okay? And I was just here just in case. Sit back down. Good. So that's how you do a SIS transfer. Just remember, the shoulder, you're not supposed to pull up on it. So let's review some of the big picture points. Protect your back. If you saw me in the earlier transfer with the mod to max assist, my back was pretty straight and I had a good squat. You need your back in order to do these transfers, so be really careful. Nose over toes, they need to get far forward enough so that they can shift their weight over and stand up. It's impossible to do it if they just try straight up. Proper positioning for both you and them, and the surface height. She was at a low surface, but if someone's having trouble, you can always raise it up, and that should be easier for them. Thanks for watching.